Just a quick mention of red reflex. It's a very simple test which can be done by anyone who is basically trained, and you need an ophthalmoscope. You may need to darken the room in especially the dark colored babies. The fair babies, usually the pupils are well dilated anyway, and it can be easily seen. And you just need to keep it, and you may adjust the power according to the baby and your correction. So usually +2 or 3 is a reasonable measure, but you can adjust it to improve the clarity. You're not looking at the fundus, you're only looking for a flash of red when you look through the pupils, and you normally keep it around a foot away from the baby, about 20 to 30 centimeters. You hold the baby, and the same examiner holding the eyelids apart when you're checking helps the coordination. It also reduces undue disturbance of the baby, because over time you would learn how to be gentle and the baby doesn't cry when you're handling. And because if the baby starts crying, the eye starts shutting tighter, you need to do it early on in your examination system. If the baby is sleeping, again, a gentle movement of the eyes is enough to open it. If the baby is not settling down, holding and rocking, the baby tends, they open the eyes spontaneously, and you have to be alert and catch it then. So we are mainly doing it to make sure the pathway of light is clear. If you see the red reflex, it means it's normal. But if you don't see the red reflex and it looks white, you need to refer to the ophthalmologist, because you may have problems like congenital cataract, you may have hyperplastic vitreous, and other underlying problems. Of course, it's not a bad idea to look at it quickly, even in the future visits, because problems like retinoblastoma, even though we are very rare, it may be picked up. Another common concern in the newborn babies is a subconjunctival hemorrhage, which is benign due to the pressure and congestion around the time of delivery, and this doesn't need referral to the ophthalmologist unless it's very extensive.